And good morning. It is Wednesday, the 10th of November, and this is the White Plains City School District Reopening Committee meeting. Thanks again to everyone on the committee for jumping in this morning. It's nice that now our committee meetings are kind of more of updates, which is a good thing. The more or the less kind of breaking news related to COVID-19, the better. And the news from the county at Monday's meeting was positive, continues to be positive. The numbers of COVID-19 positivity in our county continue to remain low. There's a very cautious eye, as you all can remember, having lived through it last year, to the Thanksgiving holiday and then the winter holidays that follow quickly behind. I think, and I don't know for sure, but I think one of, if not the kind of the pivotal factor, two pivotal factors we're looking at right now when we're thinking about the off-ramp from COVID-19 health and safety requirements will be how we perform as a state following the holiday season. And what I mean by is whether or not those COVID-19 positivity rates dramatically increase or whether they remain somewhat stable. One can expect there to be a slight spike, particularly as we move into the winter months, similar to what we saw last year. However, as you all know, in the White Plains City School District, since our last meeting, we continue to be in a very strong position with regard to COVID-19 identification in the school district, coming to the school district. Low numbers, thankfully, when we do identify positive cases, the impact has been thankfully minimal. Disruptions to classroom continuity, to school operations has been far different than we saw last year this time, which is great. And I know for all the members of the committee, for all of you who worked so hard to get to where we are today, that is always welcome news. I have a couple of quick updates that I would like to give you before I turn to our membership. But before that, I always like to, first of all, thank our Board of Education members, and we have our President Rosemarie Tonge-Eller with us and Trustee Cheryl Brady. Rosemarie, always like to kind of give you the microphone right at the get-go, see if there's anything you'd like to share.
Oh, no, thank you. Good morning, everyone, and just our continued appreciation for all you do. Your insight and your feedback is so important to us. So just on behalf of the Board of Education, our sincere thanks for what you do and what you'll continue to do. And we are just so happy to have you all and work with you. Thank you.
Thanks, Rosemarie. So a couple of quick updates for you, and I'm going to kick it over to Maggie to give you. We have an exciting day today. We're really fortunate. We're looking forward to being the first school district to kind of work with the county to help them establish their protocol for the vaccination of 5 to 11-year-olds. Many parents and guardians all throughout the state have been seeking opportunities for vaccination for their kids, some successful and some having difficulty. As you can imagine, there's a big push in the pediatric world to get vaccine. I know that as the weeks go on that it will be available, but of course, at the outset, those appointments are few and far between. We're fortunate that this week we're able to serve 270 of our tigers whose families are willing and able to begin the vaccination 2-course process today. Maggie, we launched that link to make an appointment probably around noon on Monday, and I would say by 5 or 6 o'clock they were full. Does that sound about right, Mag?
And I have to say that I've gotten several phone calls of people that want to get vaccinated. So they added a 3rd vaccine clinic for Friday, which was then filled up in 3 hours. So yeah, so I keep looking at all the links every day. If we get a new link, I'm going to share it out. because I think that the most important thing is for us to vaccinate all the little ones before the holiday if we can. So we can prevent the spread. So
Thanks, Maggie. Thanks to your team for liaising and coordinating with the county. The county is obviously well, not obviously, but the protocol and the kind of rollout for vaccination of 5 to 11-year-olds is necessarily a little bit more complicated for the younger children than for adults. As you can imagine, there's a lot of care and attention to bedside manner for the administration of injections for little ones, right? Sometimes little ones get a little apprehensive when it's time for a shot. So the county really wants to make sure that they have a good sense of the best way to approach the vaccination clinic for kids. And we're working with them to provide them that opportunity to solidify everything. And those shots are going to be administered at the Westchester County Department of Health on Court Street. So it's not in the school district, but it's close to the school district. And we're going to be continuing to work with the county to stay on the top of the list to offer more vaccine opportunities for our kids as they get more shots and it becomes more available. So we'll continue to press that out and share that with our community as time goes on. There is a FOIL request, a Freedom of Information Law request that's been sent out by the Journal News to all the school districts in the region regarding the percentage or the number of school employees who are not vaccinated or are unable to be vaccinated and who are required to test, so that you're aware. I don't know when this article is coming out. We did share the information that we have, our data set, and just so that the committee is aware, we are in a very, very strong position. Kudos to everybody in the White Plains City School District. Out of all of our faculty and staff members, we're at 7.4% unvaccinated. 7.4% is an extraordinarily strong percentage. Remember, there are people who can't get vaccinated for health, for medical reasons. So, this is a great indicator of the resilience of our district to be able to work through infection. Just again, thanks to everybody. Folks were like, well, what are the breakdowns? I'll give you the breakdowns real quick, just so you know. About 3.5% or 26 teachers are identified as unvaccinated, and just about 13% or around 68 support staff members, non-teachers, are unvaccinated in the district for, a total again of 7.4%. So that's really strong, and we're again grateful to everybody who made the effort. And we still have people who are looking to get vaccinated who haven't yet. So that number that percentage will continue to shrink as more folks take advantage of vaccination in the district. And I think the last thing that I just want to give an update to the committee on is we are working to plan in as best as we can, again, the off-ramp away from COVID-19 health and safety mitigation requirements. Now, let me be very, very clear. We're not making any changes. I'm not recommending any changes. But I do recognize that top of many people's minds is, hey, when is this going to be over? And I think that's a very, very fair question. We have been working with our regional partners to collaborate with the New York State Department of Health to arrive at some data set. I don't know what it is because I'm not, that's not my professional role, but some data set for us to be able to point to and move to begin to sort of, again, unload some of the requirements that have been put on. One of the things that we've been talking about, and it's very important to us, very important to our community members, is being able to come back together in person. Had a great conversation with members of the PTA yesterday. Our PTA does really tremendous things with and for our children and all types of outside of school extracurricular events. And we want to begin and continue to bring all of that back. It's so important to our community. So having those conversations and trying to get to a place where we can anticipate what does the end look like, And look, I understand and completely respect. There are going to be people who, even when restrictions are reduced, are going to want to continue to maintain a higher level of vigilance. And that's totally fine. What we want to do is we want to try and figure out when we hit the finish line, or at least get close to a place, so that moms and dads and guardians and kiddos and faculty and staff members can have sort of a roadmap. And we've seen other states begin to put in metrics. Some states, for instance, are shooting toward an 80% total vaccination for all members of the state as their metric for the off-ramp. As more children are able to take advantage of the vaccination, pediatric vaccination, I think we'll start to see those numbers come up. I don't know that that's necessarily going to be the way New York goes, but we do know that the questions of, hey, when are we going to be able to, come back to regular in-person meetings? Or, hey, when am I going to be able to not have to wear a mask all the time in school facilities? They're fair questions, and they deserve answers. So we are advocating for some type of guidance that folks can look toward and work toward to move the communities forward. Now, we understand that anytime, anything can change at any point in time. We all know that. We've been living this for 2 years now. But if our numbers remain static, if we stay in this plateau or they continue to go down, these are all signs that we want to see. We also know that at the same time, we're headed into cold flu season, and we're headed indoors, and the holidays and travel. So there's these, competing factors, but at the same time, it will be good to get a metric on the books that we can all be pulling toward in the same direction. So I'll keep you posted on that as far as any updates that we have. And just so you're aware, our next reopening committee meeting will take place after the Thanksgiving holiday. So, enjoy Thanksgiving, enjoy your families, and certainly, hopefully get a little bit of a rest there if you can. Also do want to thank all of our veterans. Tomorrow's Veterans Day. And as you know, in the White Plains City School District, we are always grateful. And it's an honor to recognize all of our veterans. So that's it for me. I want to go around just to see if anyone from the team has any updates. And then, of course, as always, open it up to the committee. I'm going to start off with Maggie. Maggie, anything new coming out of Health Services?
No, we are testing the unvaccinated weekly, and it's going so smooth. Everything is working out really well, and everybody is doing what they're supposed to do. So I'm really happy and proud of all of my staff members that have been so gracious. So I have to say thank you. And a shout out to Rosemarie, because Pfizer is doing the kiddos first. And it's an amazing thing that we have a vaccine to actually control a pandemic. So this is a historical time frame. And today I'm going to be part of that Department of Health vaccine clinic for these children. And I think it's amazing. So all I have to say is that I'm grateful for everyone, and thank you.
Thanks, Maggie. Anybody have any questions for Maggie? Go ahead, Cheryl.
So Maggie, the testing has rolled out, and have everybody been notified what kind of schedule they're on?
Yes, the schedule is quite robust. It starts at 7 a.m. to 1 p.m. and 2 p.m. to 5 p.m. every Friday and every Monday. And it's weekly, and everybody's been coming, and it's been fine. It's
okay. So I guess I'll have to follow up with you offline, because sure. I haven't seen anything about it. So
yeah, I try to make it a little more private, so I only email the unvaccinated. So that's why you don't see a bunch of emails going out. So if you're vaccinated, you're not going to get an email, only if you're unvaccinated.
No, but what about the testing then for students?
Cheryl, remember the testing program, that's the required program, is the program for the folks who are unvaccinated. That's the one to which Maggie's referring to.
Oh, I'm sorry. I was referring to the optional program.
Yes, the optional program, remember, it's random. So those individuals will be notified in random buckets when they come up, right, Maggie? And it's going to be their time to test.
Okay, so
Right.
there's no specific schedule that's for the optional.
Yes, there is. I want to also mention that next week on November 15th, the week of November 15th, we're going to start to do the saliva testing. I am working with the company, so I have to make sure that I have everything here before I send out a notice to everyone.
Okay, so that
So-
hasn't started yet. Okay,
Right.
thank you. Thank you.
You're welcome.
We'll make sure that nobody misses it. Jessica, morning.
Good morning. My question was around vaccination for the kids. When the kids get vaccinated, do we have to report that, or do you just get that information from the state so that you know what percentage of the students have been vaccinated 5 to 11?
Yep, that's a great question. So if you go and you get your child vaccinated at the pediatrician, or if you pop into a pharmacy, I would recommend that you let your school nurse know, and you can feel comfortable to, if you're comfortable, to share the vaccination, a copy of the vaccination card to go in your child's file. Where you're not sure how the state is going to interlace the vaccination with school districts, and whether or not that will, it's going to take some time, certainly, even if they do send all that information to school districts for that to be populated. So definitely reach out and just let your school nurse know.
And
Okay,
also,
thanks.
I think it's going to be very important, because if your child is vaccinated and they're exposed, they may not have to quarantine. But if the nurse does not know that your child is vaccinated, she's going to try to quarantine your child. So it would make life so much easier if people communicate to the nurses so that they have a running list of all the children that are vaccinated.
Okay. Are you going to let everybody know that? Because people I know
Yes.
are getting vaccinated now. My son was vaccinated yesterday, thank goodness.
Yeah, I'm gonna K-12 that, absolutely.
Okay, thanks.
You're
For
welcome.
folks watching at home, it's important that I just say this. Remember, vaccinations are not required. They're not required. If you have questions about vaccination, please reach out to your healthcare provider, child's pediatrician. But the reporting of at this time is not required, though very, very helpful, particularly if there's a potential exposure that could limit or even omit your child from being part of a contact trace. Just a little public service. Dr. Longobardi, I see you. How are you? Good to see you.
Hi, I apologize for being late. Good morning, everyone. Yes, very exciting of vaccinating the little ones. Our practice did over 300 kids yesterday. So it was as popular as we thought it would be. Running out of appointments for that first a lot that they gave us, but there are other places to go, but it would be best probably to get your pediatrician, especially for the little ones. I don't think many other people are doing the little kids there, but it's very exciting.
Thanks, Doc. Adele, good morning.
Good morning, Dr. Ricca. I would just like to take a moment to thank all of the nurses in the school district. They are working tirelessly and doing a tremendous job keeping confidentiality not only of staff members, but of our students, and their professionalism with the families. They deserve a huge thank you.
Absolutely. Thanks, Adele. And thanks to all of our nurses and all of our health aides and everybody who is staying in the fight and helping us move forward. Any other questions for health services? Okay, great. Dr. Hand, any news, any updates from CNI? I think we're probably pretty good, but.
No, we're good. We're good. Just like I said, the last meeting, we're moving forward. We had a professional development day on November 2nd. That was extremely successful. I just want to give a shout out to all of our principals and coordinators and assistant principals for doing such a wonderful job, and our teachers for engaging and learning together. It was just amazing. And we also had Dr. Jose Medina working with our teachers, our dual language teachers this week. He's a researcher and he was connected to CAL, which is the Center for Applied Linguistics, and now he's working on his own as a consultant. They were working on the biliteracy framework as well as translanguaging, just giving those as a couple examples of business as usual moving forward. We're involved in long-range planning and budget building for next year and gearing up for kindergarten registration. So anybody who has a child of kindergarten age or incoming kindergarten age, look out for information about registration, and we're ready to move ahead with that as well. Oh, and it's the end of the first marking period for secondary schools this Friday, and probably before we have the next meeting, it will be the close of the marking period for elementary school. I have a lot more to share, but I think that that's enough right now.
Dr. Hand. Ms. Pepper, any updates from HR COVID-19?
Good morning, everyone. Nothing to report today, Dr. Ricca. Thank you.
Thank you, sir. And good morning.
Good morning. Nothing to report regarding COVID-19.
Great, thanks. Food services, I want to give a big shout out to Dawn McGinn and all of our food service professionals. Really just great stuff. We heard from our student representatives at Monday's Board of Education meeting, Dawn. A lot of support and thanks and appreciation for all of the efforts of food service, not only to increase the array of opportunities at lunch, but also for the attention being paid to the comfort level for kids when they're eating. And so Dawn, thanks so much. I know you guys have been working really hard on all of that.
Thank you, and thanks for all the support from everybody. The staff will be very happy to hear that their efforts aren't going unnoticed. So appreciated very much.
You bet. Sergio, I also want to thank you. Transportation, at the outset of the school year is always it's a challenge, but I will say, we've been fortunate and very pleased to see that to and from school, we've not seen to date issues, many issues related to COVID-19. I know there was a lot of work that went into partnering with National Express to ensure that their employees who we contract, but who are not our employees, are also following all of our health safety expectations and standards. So thank you for leading that and facilitating where need be.
Appreciate that very much, Dr. Ricca. Thank you.
You bet. Anybody have any questions for transportation or food services? Great. Jeremy, I also want to just give a big shout out to you, as well as all of our security support professionals. A lot of work, a lot of support going in. We just also, and again, thanks to Adele and CSEA for being supportive of us helping our team by getting extra assistance on the ground at the high school and also at Highlands. We are grateful and appreciative to everybody who is helping us keep our kiddos safe every day. So thanks, Jeremy, for that. General questions. Any? You know what, Rena? How are you? Good to see you. Anything?
Good. How?
Yeah, go ahead.
Good. Yeah. No, nothing. Really new on my end. We're all really just enjoying being back in school. And we're just so thankful for all of the committee's efforts and works, and thanking all the teachers who are giving us our education.
Thanks, Rena. Congratulations again on a great season.
Thank you.
You're welcome. In the chat, I put a link, thanks to one of our PTA moms who sent this along to me this morning. The state, like they did previously, is also giving an incentive that's out there, if you're interested, for 5 to 11-year-olds who get vaccinated to potentially get their college experience paid for, undergraduate, of course, at SUNY and CUNY schools. So if you are interested in, I guess, entering your name in this raffle or lottery opportunity, it is at www.governor.ny.gov, and that link is in the chat as well. So anyone who has a child 5 to 11 can enter the child in and potentially get a free or paid for state undergraduate education. General questions, comments, or concerns about anything? Great. Well, again, thank you so much. We're going to send an invitation out. It'll be the week that we come back, the first week in December, the week that we come back from the Thanksgiving holiday. Again, happy Thanksgiving to everybody. Those who are celebrating, happy Hanukkah, starts on the weekend of Thanksgiving, and we are officially in the holiday season. Keep washing those hands, staying home when you're not feeling well, and looking after yourself and your loved ones. Have a great day, everybody. Thanks again.